Okay, so I'm just going to start now. There has been, oh, by the way, I'm Trish from InMode. Thank you everyone for joining us this evening. There has been a slight change to our program due to Cyclone Alfred. Tali, who was meant to speak for us, is unfortunately stuck in her house with no power. So we will reschedule Tali's session for another time. However, we do have Dr. Paul Hahn here, who will speak on achieving glass-like skin therapy or glass-like skin with Morpheus, Lumecca, and Exosomes. Now, just a little bit of a background, obviously, who InMode is. So InMode is a global leader in minimally invasive technology with radio frequency. And what we did back in 2024 is we partnered with one of the global leaders in exosome therapy, that being ExoCoBio. They are the biopharmaceutical leader in regenerative aesthetics with exosomes. And we saw a synergy between InMode and ExoCoBio to complement treatments, that being with radio frequency and exosomes to enhance patient results. So we're lucky here to have Dr. Paul Hahn with us.
Hello, everyone.
Go through everything exosomes. He is a global speaker for both ExoCoBio, who is our manufacturer of exosomes, as well as InMode for Morpheus. So I'm going to try and get to the next slide somehow. All right. Take it away.
I think the SK Exosome was launched last year, March, and I've been a huge fan since then when it was launched. Basically, I've been waiting for this product to come into Australia because this is the topic that I normally talk overseas. This is the recent topic that I spoke to about in Incas Paris. It's an emerging role of exosome as a skin healer and ultimate regenerator. And it is, I'm actually making full use of this exosome as a skin healer, as an anti-inflammatory, my ultimate anti-inflammatory medicine, and then as an ultimate regenerator. So today's topic is achieving Korean glassy skin. As you were aware, I'm a Korean background. I've been in industry for 20 years. Now, I'm practicing in Sydney, but what we've noticed in the past is that in Australia, we haven't been concentrating too much on the skin, quality of the skin in the past. We've been just putting toxins and fillers for most of our clients. Now the trend is changing. Now we have to look at quality of the skin. And the best way to achieve this is to a combination of some treatments, but exosome is just essential part of all of these to achieve the quickest way to achieve the Korean glassy skin. Now, this is just a Google, if you Google Korean glassy skin, this is what it says. It's a skin that's so healthy, clear, dewy, it looks like it was made from glass. The aim is to achieve skin that has smooth surface, no bumps or rough texture, so no pores, no fine wrinkles, and a cushiony layer of watery directly under the surface of the skin. It sounds hard to achieve, right? And it is very costly. In the past, to achieve this, all the Korean ladies has to be diligent. They can't be lazy. You have to be diligent with everything. You have to get everything done. You have to do a lot of combination treatment done. But in the past, what we were missing was we had RF microneedling, we had IPL, but we didn't have exosome. So this is going to make a biggest difference in treating and getting your clients to get the Korean glassy skin. Next slide, please. So as we know, to achieve the Korean glassy skin, we basically need to have a perfect skin. But not everyone has a perfect skin. Everyone has different skin types. Whatever the clients that you come into, they all have different issue. So for me to talk about achieving a Korean glassy skin, it's hard because everyone is different. Everyone will need different treatment. But to achieve the best, quickest result out Korean glassy skin, I almost always combine RF microneedling, which is Morpheus 8, which I use it at my clinic, and also Lumecca, which is IPL, and the combination of the exosome straight after. So the reason there's a reason there has to be a reason for doing all these three. We don't do these three costly treatment without any reason. So morpheusate will boost your collagen. It will even out your surface, tighten your pore, get rid of basically resurface your skin. And usually resurfacing tip is more than enough to achieve this. If the client has deeper scars, or if you have a deeper static wrinkles, or basically too much saggy skin, you may need to use the 24 pin for a bit of tightening as well. But in my clinic, most of my clients who's been to my clinic for more than 10 to 15 years, they usually have a good skin. And all they need is a bit of resurfacing tip just to get that rejuvenation result, and to get this exosome into your skin legally. Off-label, you need to inject, but legally, you need to apply this exosome topically with the microchannel created by the morpheusate. So this is actually quite a good combination to create the channel and get the maximum result out of the exosome that we topically apply. Now, the reason for Lumecca is in achieving the Korean glassy skin is we can't have Korean glassy skin with pigmentation disorders. We can't have people with redness. We can't have people with black pigments. So we have to get rid of whatever's black, which is pigment, basically, including superficial pigmentation, as well as some PIHs. And also, we have to treat the vascular component. With the vasculature in your face showing as redness on your skin, it's not going to, whatever we do, people won't have a Korean glassy skin. So people will need either one of them or combination of them, but exosome is essential part of it. This has to be done. Next slide, please. So just a bit about exosome. I know it's a hard concept to understand exosome when I first used it, and when it's hard to understand for me as well. But the easiest way to tell my client is it's not a stem cell. It's from the stem cell, and we extracted. Luckily, the one that we're getting in Australia is from human mesenchymal, so it's from human fat source. In the other countries, they're getting rose stem cell. I know a lot of companies trying to say the source is not important, but it is to me. I think it is important. Human source, I think, generally has a stronger therapeutic result in terms of anti-inflammatory result and regeneration result. I know this from the fact that some of the country initially got a human source, and they, for legal reason, they changed to rose stem cell. And from my colleagues in those countries, they say that they see a small decrease in the result, not consistent result, but luckily, in Australia, we're getting this adipose stem cell. So what I tell my client, the source is from human stem cell. In people in the young 20, 30 without any health issue. So from this master cell, we do a liposuction and extract a stem cell from it. Now, because the stem cell can only be injected into that person who we extracted from, so we can't actually use this. So what this clever company in Korea did, they found a communication between this stem cell. So this is what I tell my clients. I wouldn't tell this to my doctor colleagues, but this is what I tell my clients for them to better understand this easier. So it contains the information. It's a messenger from the stem cell. So it has the information of that stem cell, which is really especially good for anti-inflammation and regeneration. So this is what we need. And I tell my client, more damaged skin you have, better the result. So what we're doing with the combination is we intentionally damaging the skin. And by applying the exosome straight after, through the accelerated healing and its anti-inflammatory and regenerative properties, we're getting a enhanced result with any of the energy-based devices if you combine with the exosome. Next slide, please. Now, the reason why it's important, now in the past I thought it wasn't important, but it is important because I've actually used 4 different brands of exosome. And I think in the future, we're going to be inundated with more and more exosome. But the reason why I chose this, I mean, InMode is also, InMode is not a dumb company. They're a world leading company, and they they would have thought about this couple of years to partner with this excellent exosome company. And this is the reason. They're basically mostly scientifically validated. So once the science is validated, for me, the result is important, consistency in result and safety profile. So this company actually fits right into my philosophy or of my practice. So they fit right into it. They have the science behind it. They're most published. They're most scientifically validated company. I've been to their company. Their company's their factory is wonderful with all these equipments. And last of all, it's lyophilized, so it's not in liquid form. That's really important. I've seen with the other companies. I won't mention which brand. I've had some reactions, some immune response, some redness and swellings with the exosome, and so I wouldn't want to see that with my clients. And since I changed into this exosome, SK exosome, I haven't seen not any of that. And then I'm actually since March last year, I think I'm going through maybe 50 to 100 per week of the vials every week because of the safety profile. So the reason why people can see some immune response when even if you're topically applying, not even off-label injecting, is because this reason. SK exosome is a pure exosome. It's not from the conditioned media, but most of the company which claim to have a pure exosome, they're not. They're directly from the other conditioned media or conditioned media with the concentrated exosome, and those other non-exosome component will cause those immune reaction. So that's why this is really important. Next, please. So the reason there's so many brands of these mesotherapies, so-called mesotherapies and topical treatments out there, but the reason why this is my ultimate go-to healer, skin healer, and a regenerator is because it's got that trifecta. I use it as an anti-aging for my clients every 4 to 6 monthly if they want to use this as an anti-aging method. Uh, as I said, Korean glasses skin, as I said, I need to reset the skin, and the quickest way to reset my client's skin and get rid of the inflammation and regenerate the skin is by doing the exosome, and by restoring the damaged skin and skin barrier, we're going to achieve massive rejuvenation effect, lasting very long. For me, in my practice, I need to have a long-lasting effect with the skin boosting treatment. I can't have monthly treatment. I can't have my clients coming back 4 weekly and have 3 to 4 days of bumps all over their face to just have a 3 to 4 weeks of result. I can't have that. So in the past, I was reluctant in terms of long-term and consistent usage of HA Skin Booster with the short-acting result. Now with the exosome, I find that as a skin boosting result, it even lasts a good 4 to 6 months. So this is a nice table which I summarize. A lot of people ask me. So this slide I put it in because a lot of people ask me, what's the difference? What's the difference between HA Skin Boosters? And the most question that I get asked recently is the polynucleotide and the difference between the polynucleotide and the exosome. They are completely different. You shouldn't even be comparing it. Maybe you should, we can put it in the same category as regenerative medicine, but polynucleotide as a regenerative agent, it's very weak. Although clinically the result that you see with the polynucleotide is similar to exosome, people with real inflammation, pimples, scars, SK exosome is the most potent regenerator, anti-inflammatory medicine that I use in my clinic. So how I tell them, if you want a little bit more rejuvenation result, polynucleotide is the one. If you want more therapeutic result with anti-inflammatory properties and regeneration properties, you got to do the exosome. You can't even match the regenerative and anti-inflammatory property of the exosome. And having said that, as a usage of as a skin boosting result, as you know, HA skin boosters, hyaluronic acid, they don't last long enough to for the result to last a couple of months. Probably the result is strong for a few weeks and the result disappears after 4 to 6 weeks. Same with the polynucleotide. It tends to last a little bit longer than HA skin boosters, but the result is completely different. And if you just do polynucleotides for everyone, you're not going to see the same result for everyone, because you got to pick the right clients for polynucleotides. So you got to pick the damaged skin people, then you will see a good result with the polynucleotides. But as an overall skin boosting treatment, I find SK Exosome fitting that criteria in my clinic. Has to last long, has to have a good result, has to have a good anti-inflammatory and regenerative property. So this is a nice table for you to show you. Next, please. Okay, I think a bit. I think we lost.
I
Can
think
everyone
we
hear me?
lost. Hang on.
Where did you lose me?
I'm just gonna go back.
I think I was talking by myself.
Hang on. I think everyone's still there.
Okay. So where did you guys hear me till?
Just about we were up to ASCE exosomes in this
Okay.
table.
Yeah, so basically, SCA exosome has the most potent anti-inflammatory effect and regenerative effect, especially on the where in my practice I use mostly on the PIE clients who's had erythema component and hyperpigmentation component from the laser induced. I get excellent result with that. And in terms of hair growth, it's unparalleled result on your hair, and it lasts a very long time. As a skin boosting treatment, it lasts 4 to 6 weeks. And if you pick the right clients for this treatment, the result consistency and the result and the response rate will increase. So pick the people with the, I will show you a lot of before and after pictures later on. So if you pick those people to try these treatments on, you will appreciate what I'm meant to tell you. So basically, in my clinic over the last 12 months, Exosome has been integrated into all of the aspect of my if you look at everything, it's got all the indication of any aesthetic clinics that we need to treat. So these are acne. We can treat acne very easily without having to put them on medications. Now I'm getting great result with aesthetic and aesthetic wrinkles, pore, scar result. So these are all the treatment that I combine with the exosome now. Basically, it's basically everything. So hair, in terms of combined with all the treatments and the scar treatments. So it's basically everything. But today we're going to concentrate on the skin. So we'll go to the next slide. Now, this is an example of just some Morpheus. You need to know, if you want to combine treatment, you need to know what each treatment does. So you need to know, before you start combining, you need to know what Morpheus 8 does, what it can do, clinically what you see after Morpheus 8. And then you need to do a lot of cases of the ski exosome. And then if you know the result, what clinical result that you get, you can now combine. You know which one to combine. Now, I just wanted to show you different combination. So Morpheus 8, single session of Morpheus 8, and this is a single session of ski exosome topically applied straight after Morpheus 8. First picture is before picture, middle picture is 1 month after, and the last picture on the right is 3 months after. So as you can see, this client actually got this hyperpigmentation from the laser. So she didn't want to have further laser treatment to get rid of this pigmentation. So laser was out. So we didn't have a laser as our option to treat this lady. And also she didn't want to have a toxin to get rid of her crow's feet. So I asked her, let's go for morphosane and topical SK exosome. And this is amazing result that I received over the last 3 months. As you can see in the brightening and the smoothing result, pigmentation is broken down a lot, probably more than 70 to 80% reduced. And if you look at the quality of the skin around her crow's feet, you can really appreciate the rejuvenation result of the morpheus-8 combination result of morpheus and SK exosome. And I've been using morpheus-8 for the last 6-7 years. And if you just do morpheus-8 by itself, you're not going to get this result. This has to be a combined result of the morpheus-8 and an exosome. Okay, next one, please. Now, this is one of the first case. When I didn't know about the exosome, this is one of the first client that I tried exosome on. So this lady was getting regular Lumecca in the past. It's been working, but she has to come every couple of months to get this vascular component under control. So she was happy with just Lumecca alone in the past. But when I had the Eski and combined with the Lumecca straight after, I was able to achieve a result which I could never achieve in the past. Basically, she's not getting any pimple at all. This active flare-up, this of pimple, she's been suffering whole life, and whatever she did, it never disappeared. But the single session of Lumecca and a combination of Eski exosome, uh, I was able to achieve this result, and she's not getting pimple at all, and she's not on any medication anymore. Now, so she's had 3 sessions in a row, but this result is after single session. And then she's getting maybe 4 to 6 monthly maintenance session of exosome combined with the Lumecca. Next, before and after, please. Now, this is also interesting case. A gentleman with a lot of rolling chronic scar, very old scars, a mixture of old scars and an active pimple, rolling scars, and he's got the whole lot. So when I saw him, in the past, I would need when these kind of clients come in, I get scared because they need to spend a lot of money to achieve any result like that. But not anymore because since the introduction of exosome, everything's changed, as I said, and actually minimize the cost for my clients to achieve these similar results with the previous treatment combination treatment. So I was able to achieve this result with just single session. If I have a close-up of this client of that left side scar, next picture. Now, if you have a close look, a lot of things happened. If you look at the date, it's 9th of January this year, and he came back 2 weeks after. Could you think about any treatment, any combination treatment which could do this in 2 weeks? I can't, to be honest, I can't think of any treatment which can do that in 2 weeks without any downtime. So if you look at the whole indented area, it's actually filled. And if you look at the individual scar itself with the red base, the red base is almost gone. So erythema component of the base is the scar is gone, and you look at the brightening and smoothing of the scars, the whole lot. Okay, next please. So when I saw these results, I started doing exosome and exosome and the IPL for all of my clients with these kind of scar, rolling scar with red base, active inflammation component. So I can achieve now consistently like that. So whenever I get this client on the left like that, I can offer IPL plus minus RF microneedling and exosome, and I'm able to reproduce this result day in and out. Next client, please. So same, this client did 1 session of exosome as a monotherapy last year, September. And she went to Dubai for 3 months, and she came back after 3 months and without any treatment, just single session of monotherapy SK exosome, and she was pimple-free. And she was even scar-free. I was really amazed to see that. Even the redness on the base of the scars are all gone. So, and she's actually pimple free for more than 6 months, and I haven't seen her since then. So, I think she's about due to have her 6 monthly maintenance exosome to get the pimple under control and for the rejuvenation result like this. Next client, please. Okay, same. This shows you how strong anti-inflammatory result and on this rosacea client is. I've done few sessions of IPL in the past. It didn't work, so it was quite resistant with the IPL treatments. But when I did 3 sessions of SK exosome, I was able to treat all of her severe tortuous rosacea with the symptoms. Next slide, please. So as you can see, the top picture is actually worse. And then this is after 2 sessions, it's about 90% treated. The other side, which is the right side, which is not as severe as the left side, after 2 sessions, it was completely treated. So after 3 sessions, I was able to treat most severe case of rosacea that I can get in my clinic. Next next one, please. Next slide. Same. This lady suffered from 20 years of flushing red rosacea, which she couldn't get any improvement with previous treatments. So when she came in, I just did 1 session of SK exosome, and this is the result. It was completely gone. She was symptom free. Her rosacea, redness on the surface of her skin is completely gone as well. Next slide, please. So same, this is on the left side and the right side, and she's so happy that she did this treatment, and she's just getting every 3 to 4 monthly maintenance session to achieve this result, maintain this result. Next one, please. Now, this is, I don't know whether you guys get a lot of these clients, but in my clinic, I do get a lot of these clients, usually from Asian clients who's had lasers in the past, picosecond lasers, or even Q-switch lasers or IPL. If you're a lot of Asian-oriented clinic-based clients, you will see a lot of these clients. These are very difficult to treat in the past. And in the past, whatever the treatment that we did, it doesn't work, or it just works too a little bit, and we just go back and forth, and we just wasted our time. So this client got this from picosecond laser. 5 years ago, and she had about 6 months of laser rest period to get the PIE component disappeared. But whatever we did, nothing worked, and then she actually gave up on the treatment. When I offered her the SK exosome as a trial, she was happy to try, and then when I did this treatment, after single session, I was able to achieve this result. So basically, the PIE erythema component that she had. I think I'm lost again, right?
All right. What can you
But,
see your
okay,
screen
back
again?
online, right?
Yeah.
Yeah. So what you do these cases, if you get any of these PIE plus PIH cases after laser treatment in your clinic, or if anyone who walks into your clinic with like a face like this, give them you prep them with exosome first. Get rid of the inflammation part first. Then treat the pigment component with the low energy setting of Q switch. Then you'll be able to treat this so easy now. Now, this client didn't want to have further laser treatment, and all I'm doing is a 3 to 6 sessions of XK exosome every 2 to 3 weeks, and most of the PIE and the PIH component is settled down. So now we're just maintaining every 4 to 6 monthly session of SK exosome to achieve this result. Next one, please. Now, this one is an interesting case. I've done 3 sessions of morpheus-8 and 3 sessions of collagen stimulators. So first 4 pictures in the bottom is from morpheus-8 and collagen stimulators. What it's lacking was that healthy skin. So I was able to achieve good skin tightening result with the morpheus-8 and collagen stimulators in the past, but I wasn't able to achieve that healthy looking skin with this client. So when I offered him to do a exosome, the last picture is after doing 1 session of exosome. So he was already happy with the previous result with the morpheus-8, but this exosome actually completed my treatment by making the skin quality excellent like this. So I think exosome completes a lot of treatment. Now, this one is also to show you a single session of morpheus-8 result combined with the topical application of exosome. So I can achieve a lot. In the past, I can't achieve this result with just single session of morpheus-8. Now with the accelerated healing and boosting of the collagen production of the adjuvant exosome therapy, we can achieve this result even with a single session. Okay, next one, please. Now, this one is to show you the Korean glassy skin. So we need to achieve a glassy skin. We need the skin texture needs to improve more like that. So this is the client that I showed you in the previous picture with the single session of Morpheset and a single session of topical SK Exosome. And this is the result after 1 month. Next one, please. And so this is without toxin. Now, these two are sisters. What they did, as I told you, if you get a client coming in, walking in like that with bit of pimple, inflamed skin, and enlarged pores, I almost always do Lumecca and Exosome. So I offered both of them on the same day, Lumecca and Exosome followed by Exosome straight away. And this after picture on the right is 2 weeks after. So they both came in 2 weeks later for the follow-up. And I was able to achieve this result. And looking at this, I've actually come up with this Korean glassy skin protocol, and IPL Lumecca has to be included, or no matter what, any case, if you want to achieve Korean glassy skin, has to be included. Okay, next one, please. So, the reason why I told you the exosome is my ultimate regenerator and ultimate skin healer is this. This lady never had pimple in her in the past, and she came in with the massive breakout of pimple all over her face. And as being an Asian client, she picked everything and left the PIH and an open wound everywhere. When she came in like that, I did exosome. This case is actually interesting because all of her pimple that she picked on left the PIH. If you can see on the forehead and the chin, you can see the PIH everywhere. Now she's got a fresh scar right in the middle of the chin. She recently picked that one when she came in, and that one I didn't actually do any microneedling. I actually applied topically because it's an open wound. So when I checked on her a couple of weeks later, it didn't form PIH like the rest of the pimple that she picked on, which formed PIH, but this one didn't form PIH because I put exosome topically on that open wound when it's still fresh. So this slide shows a lot of things. I was able to settle her massive breakout with 2 to 3 sessions of exosome, and now she's pimple free. Next slide, please. Now, same. Now you can achieve these Korean glassy skin with the male clients as well. You will have a lot of male clients with this patchy redness inflammation, which is showing as inflammation on your skin in large pores. So I didn't do anything else. I just did exosome as a monotherapy, and I was able to achieve these kind of result. Now he did 2 to 3 sessions in a row, hence the date from last November till January this year. So I can achieve this Korean glassy skin with a single session of a few sessions of exosome. Next one, please. Same glyclines. Very lumpy. Skin texture looks very rough on this Visio analysis. Look at the wrinkles, pigmentations everywhere, inflammations everywhere, showing as black and red. And look at the result after. Look at the date, end of November. And this is 2 weeks after, December. There's no treatment which can achieve this. And I can achieve this result day in and out with the introduction of exosome into my clinic. Next one, please. So same profile pictures on the Visio. They look so smooth, no inflammation whatsoever, brightened, tightened pores, skin textures improved, everything's improved, and healthy looking skin. Next one, please. Now this one, it's the same case. It's a PIE case from the laser-induced case in the past. So I can achieve this with the single session of monotherapy SK exosome now. Next one, please. So now we can achieve, now we've been talking about Korean glassy skin. Now we have to achieve this Korean glassy skin for the Western client because we live in Australia. We get all sorts of clients coming into your clinic. We get Asians, we get Caucasians, we get all sorts of clients. So I need to be able to produce similar result for my Caucasian clients. And when I did this same treatment for my client, Caucasian client, I'm achieving these kind of result for my Western clients now. So my Western clients now has Korean glassy skin. Now I think all the Western clients in Australia can have Korean glassy skin like this easily. Same, it's the same view. Front on looks so healthy, smooth, bump free, glowing. Yeah. Next one, please. Now, this is a Korean glassy skin on an Asian skin. As you have a look, the date, it's very quick. As I said, this is the quickest way to achieve Korean glassy skin. Now, this client luckily doesn't have much other things to be treated before we achieve this glow. So I didn't have to do much. I just had to offer her the SK Exosome, and this is the result. Look at the glow rejuvenation result on the right side after 2 to 3 weeks. Yeah, next one, please. Yeah, so this is just to show you the close-up of the result you can achieve. This is actually off-label. The tool is off-label. I was using 34 gauge 2 mil needle and I've been injecting intradermally as an off-label. So I can achieve these kind of result after single session. And this is the result after 2 weeks. Okay, next one, please. So it's hard to summarize Korean glassy skin in one slide. But if someone has things to be treated, you gotta treat those things first. But people with mild to moderate issues, we can just simply get away and reset the skin by using RF microneedling, morphisate, and a Lumecca, and an addition of exosome. Then we can achieve Korean glassy skin very easily. People without any issues, you can just do SK exosome by itself. But as you know, as you combine more treatment, a different treatment together, whether it's energy-based devices or more mesotherapy, people will get better result. At the end of the day, it's the cost effectiveness of the treatment and how people can afford. Look, if people can afford it, I can get them to do a lot of things together. But this is the quickest way in my clinic to achieve Korean glassy skin. Okay, and if someone wants an added result with some other result, then just add other things. If someone wants more glow and hydration on top of this result, just add HA more skin boosters. And you can formulate your own Korean glassy skin cocktail. Okay, I think that's it. For now.
Okay, so we're just going to do some Q&A. Now, for those who joined us a little bit later, I'm not sure if you heard, but Tali, unfortunately, because we are in Queensland, she is unfortunately unable to join us. So we will reschedule Morpheus8 Lumecca webinar for a later date, but I think there are some questions. So I'm just going to pop these up and ask you. So when you talk, Dr. Paul, when you talk monotherapy, are you talking topical application or directly injected into the skin?
So that is a off-label usage. Some doctors might argue so look, different ways of delivering any material into your skin gives you manifests it differently clinically on our skin. So depth is also important. Different depth achieves different result clinically. So for me, for people to say microneedling result, comparing microneedling result with the intradermal off-label intradermal result, it's different because you get different result. For my client, they're okay with all the off-label injections. So I do a lot of off-label injections. The reason being because it's a pure exosome and I don't get any reactions. So I'm confident to do off-label indications, and I can achieve these results without any without any side effect that you need to worry about.
When you talk off-label and comparing the results with another microneedling device, I know there are some people who won't do off-label, but having said that, the results still they don't differ that much, or do they differ quite a bit?
The general result is similar along the way, but I think it's the reason why people ask me, "Oh, Dr. Han, your result is always so good. Clinical result is so good." I think this could be the reason because I do a lot of cases and I found out about the differences in result by doing a lot of cases in different ways when I use new products. But clinically, exosome, if you think about the theory behind it, as I said, I actually use it as a enhancer. So do combine with the energy-based devices. But in some cases, if you try off-label usage, you will fall in love with it. And because SK Exosome has a very safe safety profile, and it's a sterile product at the end of the day. So I use it very safely in my clinic, even off-label usage.
Okay. Now there's a question here on how do you inject exosomes? Now, that is probably an off-label and off-table discussion because of
Okay. Now, I've been in the industry for 20 years, I don't blame on tools, but tools with the mesotherapy is very important. The difference in the result between the clinic is probably more with the mesotherapy. It's probably more with the tools, because these days the technique is similar. We learn from saying like mesotherapy technique is similar, but the end of the day, sorry, I got carried away. What's the question?
No, I was going to say the in how to inject the exosomes. Now we are
Okay,
obviously off.
so the
We don't
best.
condone off-label treatments from
Okay.
InMode. That is
The good
probably
thing about using SK Exosome as a skin boosting treatment is because the first thing, it comes in 5 ml vial. Okay, that's the one thing. Other product comes in 1 or 2 ml, or 3 mls, which is not enough to cover. Because the reason why we get good result with the mesotherapy is not only from the material itself, but because how we inject, how the intradermal injection creates a stretch response, which also promotes the collagen production. So the how we inject is also important, and the tool is also important in this case because we want that product right where we want without any wastage. So in my clinic I use 34 gauge needle, 2 ml depth in a about 30-degree angle, and I inject around 1.2 to 1.5 ml depth. Yeah. So if that answered you, yeah.
Thank you. Now, going back to the two sisters from the Lumecca and exosome treatment,
Mhm.
I know we say we need a microchannel. Now, if you were doing it topically, would you still apply after exosome, after Lumecca, after
Yeah.
any?
So if you don't want to do an off-label injection, you just do a microneedling
Yeah.
straight
Okay.
after.
So
Yeah.
you could do your IPL, then microneedling, and then
Of course you
topically.
can. Yes.
Yeah. So now for active acne, is it just a serum only? How many sessions and for how far apart? So if
So from my experience since last year March, so it's getting 1 year now. I'm not I'm not 100% expert yet, but from the large amount of usage that I've been doing, from the gathering of all this clinical data, what I find is older the client, they need more sessions. More severe the acne, it takes more sessions. So younger clients tends to respond better, quicker. So if it's a mild to moderate young acne clients, they respond especially really well, especially after one session. And just need maybe 3 to 4 sessions to complete the session and do a maintenance. But from older people with severe severity of the pimples, probably we need to go towards 6 sessions in a
okay,
row.
and you're saying 2 to 3 weeks apart, just
Yes,
with
I do two to
normal
three weeks.
with
Yes,
even just
that's right.
say Morpheus 8, but not the full protocol of Morpheus because you're only using it for the microchanneling.
That's right. No,
Yeah,
no, 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 no. With the acne clients, if you do, well, there's a reason why we are microneedling for acne clients.
yeah,
Yeah, not just to create microchannel. We have to. We also,
you're
treating the
helping.
scars.
Yeah,
We're also treating the inflammation.
at the same time.
Yeah. So yeah, more the better. So that's why we combine these three.
Okay. So now how many sessions of exosomes would you use for rosacea, now topical or injecting?
As I said, injection, off-label injection, most severe cases, 3 to 4 sessions only. Mild cases, 1 or 2 sessions only required every 2 to 3 weeks. And then once you achieve it, I do every 4 to 6 monthly.
Okay. And topically for rosacea?
Uh, I can't, I'm not, as I said, the ones that I know for sure, I can tell you, but because I do more off-label injections, I'm more expert in telling you about the off-label injections.
Okay.
So, I think it's all about the absorption and the wastage of the product. So if you think about those things, you probably need few more sessions to achieve similar result to intradermal. But the number doesn't change much. Just you might have to do a few more sessions.
Okay. Now, just I think that was there any other questions that we've got here? Just talking ROI, how much do you typically charge for your exosomes with combined therapies or single off-label? Let's just
So
or
I charge 700. Now, over the last 20 years, what I built up in my clinic is also the result. The amount of result has to match how much we can charge. The amount of result that I see is more than $1,000 worth of treatment, to be honest, as a single session treatment. But we can't charge $1,000 per session for this. So in my clinic, I charge 700 to 800 per session, or most of my clients buy a package of 4. And I charge them around 2,000 because they buy laser sessions as well, laser package as well. So they're paying 2,000 for laser package and another 2,000 for an exosome. So they end up paying 4,000 in one go. So so that's how I charge in my
yeah.
clinic.
Now with darker skin patients, skin type 4 to 5,
Hmm.
how would you treat? How would you treat when off-label, on label?
Well, as a single monotherapy exosome treatment, skin type is not an issue. I don't know why we talk about skin type when we're doing
No.
exosome therapy, but when it comes to IPL, Lumecca, and RF mark needling, we have to think about those things.
Yeah.
But the reason why use exosome with those treatment is to reduce those side effects of PIH and PIE.
Yeah, I do remember you telling me that now with exosomes that you have reduced the risk of PIH in your clinic by 30%.
Okay. 20 years ago, I used to use very strong CO2 fractional laser. I actually sold that one straight after. I only used it for a couple of the years because back then all my clients were dark skinned Asian clients. And then doing those strong CO2 clients, it was a headache. I had to deal with the PIH, so much PIH cases, prolonged downtime, swelling, redness, oozing, infection, PIH after that. So I had to worry about so many things when I was treating CO2 fractional laser for my Asian clients, but not anymore. Look, the technology of the CO2 has advanced as well. With the usage of exosome, I was able to reduce a lot of PIH and PIE clients and increase the energy setting as well. So I'm getting better result with those, and also at the same time reduce those PIH and PIE cases.
Okay, thank you. One more question. So I know we've been talking about glassy skin. However, hair treatments, are you doing a lot of hair treatments, and that being with Morpheus 8?
Yeah. So as I said, we don't need to use the 24 pin, which goes into. We don't need to go in 4-5 mil depth when we doing, because at the end of the day, papillary dermis fibroblast is where the senescent fibroblast cells lie, which lies at 0.3. So all we need is a resurfacing tip to achieve this. So we don't need to. So what I'm doing, the resurfacing tip for the face, I actually offer my client to do their hair because it also rejuvenates their hair too, because it makes the healthier dermis. It stimulates your hair production, and by combining with the exosome, so I'm able to do the face and hair at the same time, and do the exosome face and hair on the same day.
Yeah,
Because
that's
we
actually a really
can,
good point.
yeah, because we need to make use of that tip. It's an expensive tip, so we make use of it by cutting the cost for my client as well, do the hair and the face at the same time.
Yeah.
Yeah.
Well, thank you, Dr. Paul. Now, I think there's one more question. So the protocol for darker skin patients for glass skin. Now, if I can't go back, I don't know how to go back to that presentation, but for glass skin protocol for dark skin patients.
So depending on what we need to treat first, if the client has a lot of things to be treated, so if you're concerned about the downtime or the side effect from those treatments, I don't see why, because RF microneedling is, especially Morpheus 8 being a bipolar, which is safe for the darker skin type. I don't know why we need to worry about combining RF microneedling, the IPL, Lumecca, and Exosome. So I didn't quite understand it. The
Uh,
question.
what would be a typical protocol for darker skin patients to get your glass skin?
So it depends on what that client comes to me with. So if
Okay,
that
so you
client
say if they
has
have
no things to be treated,
no, so say there's nothing, well, maybe, okay, I was going to say for nothing to be treated, what would you suggest?
I'll still do when I'm.
PIH, sorry, Dr. Aman Binder was asking me. It's PIH.
So if you want to treat the PIH.
Yes.
So in the past, before I had the exosome, I used to use laser to treat after having other being put them on some conservative management, topical cream management. But as you know, those things don't work. I've been in industry for 20 years. I've had a lot of people being put on those topical, getting rebound, getting worse. So, but the most important step is to, if the PIH component has the erythema component to it, if you can't be doing lasers, you have to treat the erythema component first. If you do Q switch low setting Q switch laser when there is an erythema component to it, it will make it worse, and you're not going to progress, and you're going to get complaint. So when whatever you're doing, stop. Energy-based devices, stop. Topical cream, stop. Active, stop it, and then do the exosome as a monotherapy, and treat the erythema part first. Once you treat the erythema part, and then you can go back to your low setting laser treatment to treat that PIH component. So without PIE component, PIH treatment becomes really easy.
Okay. Do we have one more? We've got lots. Okay, have we got time? We've got 9 minutes. All right. So for acne scars, how deep should I go with exosomes?
So with the treating different type of scar, as I said, rolling scar, with the rolling scar, I can treat without any combination treatment. I've been getting excellent result on just on the rolling scar, not the box scars, not the ice pick scars. With the box scars and ice pick scar, you do need some dermal remodeling and to remodel the scar underneath uh, before exosome can give a good result. So with the box scar, you do need to break it down. But if you want to inject, I have a tip. I actually use hydrodissectional force of the needle. So where we have the scar, especially the raised area, I do more. So the needle I'm doing is ablation. We're making a mechanical ablation. So and by injecting intradermally, and I actually go deeper, and then as I pull it out, I inject all different layers with the exosome, and that's going to create the hydrodissectional power and achieve some subseasonal effect, as well as get the exosome result at the same time. So just the rolling scar, I do just the intradermal injection. But with the other scar, you do need to combine. You have to find a way to break down the scar underneath. So you do need to combine with the RF microneedling. Sometimes you may need CO2 fractional lasers. Sometimes you may need subcision with the fillers. Yeah, so all of those.
Okay. And I think you just answered the next question, which was combining exosomes injecting with the use of Morpheus 8. So that
Yes,
answers
so
that one.
if I'm doing that, I will be. If you have 3 different ways to deliver exosome, I will do all 3 of them in one go to achieve the best result out of my client. So if you have a way to topically apply with the Morpheus 8 microchannels, and also same time do a microneedling and do an intradermal injection, your result will be the best. But because we can't do all 3 at the same time, you can just get away with just one or the other.
Perfect. Okay, this is the final question for this evening is, hi Paul, question. If you're using resurfacing tip for face, is the radio frequency setting low? Or do you use the same protocols as normal for Morpheus? And what about Morpheus radio frequency setting for hair? So do you want to
So
answer that one, or do you want
yeah,
me
of course,
to?
of course. The reason why, so you would do the same setting as your So if we have a skin textural issues, if the client has big pores, big scars, all those things, static wrinkles, then we need to treat quite aggressively with the RF microneedling, right? Um, I'm talking about the lowest setting with the micro to achieve the Korean glasses skin with the exosome and the resurfacing tip is people without any issues. If people has issues, treat them same as you would do with the morphisate that you would normally do with your clients first.
Perfect. And that I think we will stop there. Now, again, I'm so sorry Tali can't join us, but we will reissue an invite for another webinar for Tali's session. If you do have any questions that you want to ask Dr. Paul, just scan that QR code and it'll be a contact us page. And write your questions, or you guys can contact me. I will reach out to everyone tomorrow with any questions that they may have. But again, thank you, Dr. Paul. We really appreciate your time and insights.
Thank you.
And yeah, I think we'll leave it at that. I will have a recording of this for everyone as well. Thanks, guys.